So what is pure tone audiometry? So pure tone audiometry, it is a subjective test. It is a subjective behavioral hearing test that determines the softest sound a person can hear at different pitches. Okay, so basically it is a subjective to know whether it is a conductive hearing loss, whether it is a sensory neural hearing loss. So in conductive hearing loss, air conduction decreases, bone conduction normal. So there is a air bone gap defect. Air bone gap is present. So this is conductive hearing loss. In neural hearing loss, air conduction decreases, bone conduction decreases. So there is no air bone gap. Okay. So obviously, are you getting a point? In case of conductive hearing loss, there is air bone gap present. In case of sensory neural hearing loss, there is no any air bone gap present. Okay, now these are the various symbols. If there is air conduction which is unmarked, in right it is this symbol circular, and in left it is cross. If there is air conduction marked, then it is triangular, then it is square shape. In case of bone conduction unmarked, it is this shaped. Okay, so these are the various pure tone audiometry graphs. So you can see this is the normal hearing because there is no any hearing loss, and both air conduction and bone conduction are at same level. So there is no any hearing loss. In case you can see this is air conduction and this is bone conduction. So both are present, and there is a air bone gap. So there is a air bone gap, that is the mild conductive loss. This is conductive hearing loss. Okay. Now you can see this is the air and bone conduction, but there is no any gap. So it is a sensory neural hearing loss, but it is decreasing. So it is decreasing. So it is age-related hearing loss. Okay. And the noise-induced hearing loss, there is a dip at 4000 hertz. So that is not that is noise induced hearing loss. In case of otosclerosis, there is dip at 2000. So that is otosclerosis. Okay, so these are the specific. At 2000 hertz there is a dip, so this is otosclerosis. At 4000 there is a dip, that is noise induced hearing loss. Okay, so these both are different. And in case of conductive, so first you have to see whether it is, to diagnose a pure tone audiometry, first you have to see whether it is a hearing loss or not. So like in this case, you can see in this case there is no any hearing loss. Okay, it is presented normal level, so no hearing loss. Now let's talk about this. So there is a present of gap in between the air conduction and bone conduction. So there is a gap present. So this is conductive hearing loss. This is conductive hearing loss. Okay, so in age related hearing loss, there is a hearing loss at higher frequency and in decreasing form. So this is age related hearing loss. If there is a dip at 4000 hertz, that is noise induced hearing loss. If there is a dip at 2000 hertz, then it is otosclerosis. Okay, you can see this is the at higher frequency, this is the hearing loss is increasing. So this is presbycusis, that is age related hearing loss. So did you get the pure tone audiometry?